needs to make sure that the people here are safe and secure. This man comes no other as Dr. Joseph Varon. Dr. Varon, without further ado, speak with the people, please. Thank you.
Thank you very much. And, so you guys know, I did ask Eric to let's cut all the nonsense about what I do and how I do it and stuff like that. And let's cut to the chase. We are here tonight because I want to help people out to understand what the vaccine is all about, what the fears are all about from the vaccine and debunk a lot of them. And more importantly, so that you guys can help me spread the word. I work at United Memorial Medical Center. I am the chief of staff over there. And I have been working in my COVID unit for 323 continuous days. I haven't had a single day off. I haven't had a vacation. I haven't had an afternoon off. Why? Because I have said before, my primary problem that I've had is that I've been fighting two wars. I've been fighting a war against COVID, and I've been fighting a war against stupidity, because there are a lot of people out there that have absolutely no idea of how bad this terrible illness is. As of today, you probably are aware that more than 454,000 people have died in the most powerful country of the world. Yes, in this glorious United States, the country of which many of us immigrants came here thinking that this was, the best place in the world to have a family, have a future. And yet we're seeing that things are not that good. And they're not that good because we're not paying attention to this terrible illness. So for that reason, from day one, I've been working really hard in trying to get particularly those communities at risk, communities of color, the Latinx, the African American community, to give a message that is a message as to how best can we deal with this. One, from testing, and again, I have been very fortunate to work with Congresswoman Sheila Jackson Lee. I mean, we have opened more than 50 testing centers. We have tested people everywhere. We have tested over 350,000 people. And guess what? We still have a very high positivity rate. That means of those people that we test, about 20% are positive. That means 1 in every 5 people are positive. But the dangerous part is that of those people who are positive, 48%, that means almost half of them, have no symptoms. So if you look around you right now, you truly don't know who has the virus, who doesn't have the virus. And for that reason, I think it's extremely important that now that we have an option, and that option is vaccination, that we all get vaccinated. But I was not supposed to give you a big speech or stuff like that. I just want to go ahead and answer as many questions as we can. So I'm going to ask our moderator to start asking questions.
Hey, Doctor, some questions that came in, you might have what started. One of the persons wanted to know, are there any known side effects? Known side effects for persons who have COPD, asthma, and other breathing disorders who receive the vaccine?
First of all, let me start by saying that, all the vaccines, anything that you put on your body that is not yours, can give you a side effect. But when you are thinking side effects, you need to consider, I call it a balance. I mean, is the side effect really that bad that it overweighs whatever I have in? That's number one. As far as standard side effects for all of us, I mean, most of us have a little bit of discomfort in the area. And you should have seen me when I got mine. I got mine on national TV. I have CNN. I have everybody just taking pictures of me. And the moment my nurse sticks the needle in there, I jump and I said, ouch. Yeah, I really did look like a fool. But, that's the way it is. But I had a little bit of discomfort the next day. That was on the first vaccine. On the second vaccine, I did have some fever, some chills. I had a little bit of night sweats, but they went away within 24 hours. Most people have issues with fever, a little bit of headache. Some people feel sick, but that's usually self-limited. It last no more than a day or two. If you're having those symptoms, that's actually good. That means that your immune system is working. Now, your question goes to deal specifically with patients that have pulmonary or lung conditions, such as chronic obstructive lung disease, asthma, and similar things. The fact is that, those symptoms that I just mentioned are probably the ones that you will develop, and you should not have any problems. That means you will not have a flare-up of your COPD. You will not have a flare-up of your asthma. You will not have any other issues. Now, if you're a person with a chronic migraine, you may get a little bit of headache, but it usually goes away with plain old Tylenol without any major thing. So the fact that that people are concerned of side effects, to me, is nonsense. And it's nonsense because you are talking about a tiny little, let's say a little fever, a little chills. Compare that versus dying. Dying, yes. Today, 95% of the patients that I have at United Memorial Medical Center are people that come from low-income communities and communities of color. That's what I have. And guess what? Many of them are going to die. So when I compare a little bit of fever, a little bit of chills versus dying, there is no comparison. So let's be clear. These tiny little symptoms don't get you in trouble. Don't worry about, you are not going to grow in a new eye, like a third eye. You're not going to grow in a tail. None of those things are going to happen. These vaccines are safe.
Okay. Next question, doctor. Is it feasible for persons with stage 1 kidney disease to receive the vaccine?
Absolutely. And I would tell you that, the one prognostic indicator that I have seen where, once somebody gets in trouble, their death is the presence of kidney disease. When we have patients that come into the hospital and for whatever reason, their kidneys don't work and they have COVID, that's it. So people with kidney disease should be on top of the list to get vaccinated. There is no problem getting the vaccine.
Knowing that many African Americans and other people of color, persons of color, share a strong disbelief in the current COVID vaccine due to past medical mistrust, how do you appeal to this demographic and mistrust of taking the vaccine?
Well, I have that issue even in my own ICU, my own COVID unit, where about 30% of my African American nurses, they don't want to get the vaccine. And that's because of that mistrust. But having said that, I see patients die day in and day out, every single day. The one thing that I would tell people is, I clearly have the same sensation that you have. When I was a kid, my grandma, when she found out that there were massive vaccinations in Mexico, she would say, absolutely, under no circumstances you are going to get vaccinated. Well, she had emigrated from Europe, where the Nazis had killed my entire family. So for her, one of us getting a vaccine gave her like a, you're going to be getting a shot that's going to either alter you somehow, or it's going to make you infertile, or it's going to kill you. So I can relate to the concerns that the African American community has. I truly can. And the only thing I can tell you is based on my years of education, training, and experience as a doctor, I believe that the current vaccines are safe. They don't change your thought process. They don't have a microchip, GPS, whatever people believe they do. And they clearly don't make you sterile. So I would say, please, I would beg you to get the vaccine. As I told you, I have not stopped working for 323 days. I need a break. I need a break. And the only way for me to get a break is by people doing the right thing. And that is to use the vaccine, to have the vaccine. If you have it available, please. I mean, I don't know how many times I have to say this. You have seen me on TV. I've been on every TV show that you can possibly imagine. And yet I still see people that they don't want it. We now have an option that we didn't have 12 months ago. Now we have it. So to me, it's foolish not to want to have it. Having said that, and again, by saying foolish, I'm not trying to be disrespectful because, like I said, I do understand the cultural background and cultural concerns. But at the same time, I get, I get annoyed because I say, I mean, we have finally something that we can do and people don't want to do it.
Okay, this next question, I'm going to combine both questions. We have a question in chat. One of our participants stated she took the Moderna vaccine, her first shot, and she is waiting for the second dose, and she is well afraid she has some side effects. And another question is, should you expect a different reaction or side effects after taking the second shot?
Well, that's a great question. For one, again, like I said, first, the good news is that your immune system is working. Because if you felt very sick after the first one, that means that you were mounting an immune response. That's great. Second, I really cannot tell you what to expect on the second one. Most of the people, the second one feels worse than the first one. But if you really had a really bad reaction the first time around, maybe your second won't be as bad. Again, it's just depends on each one of us. But one more time, just think about the alternative. The alternative can be death if you get the COVID. So, I mean, feeling bad for a couple of days is not that bad when all things are considered.
What are the chances of still contracting the COVID virus after having received the second shot?
Well, it depends on the timing. The way this works, you actually have, so you start mounting a response. So you start building antibodies. And as the antibodies start slowly dropping down, that's when you get the second shot. But the second shot must be given to you at exactly, for example, for Moderna, 28 days, or if you're looking to the Pfizer, it's at 21 days. And I would say you still are capable of getting sick for about a week or two after getting the second vaccine. Now, having said that, remember that both vaccines have about a 95% chance that they will protect you. So when you ask what are the chances of you getting COVID after the second vaccine, I would tell you they're about 5%. So 5 of every 100 persons, when exposed to COVID in the right situation, clinical situation, may develop COVID.
We know there's 2 vaccines on the market, and of course, Johnson & Johnson is about to come on the market. What are the major differences in the vaccines that are currently being administered?
Most of the differences of the currently ones that we have in Houston, the Houston metropolitan area, we have Moderna and we have Pfizer. To be honest with you, the primary things that are different between one and the other are how you store it, how long can you keep it outside storage, and when do you have to redose it. So Pfizer, you have to keep it on a refrigerator that is, first of all, extremely difficult to find, which keeps your vaccines at minus 70 degrees, which is pretty damn cold. You try to put in your hands in there and they freeze. And then once you get it out of the freezer to thaw it and you reconstitute it to start applying, you have 2 hours to apply it, because if not, it goes bad. That's the Pfizer. And also on the Pfizer, you can have to give the second dose at 21 days. Now, the Moderna vaccine, you don't need that unique refrigerator. You need a refrigerator that can keep things cold to about 25 to 30 degrees, minus 25 to 30 degrees. Once you reconstitute it, you can actually keep it in a refrigerator for up to 30 days. So it doesn't go to waste if you don't use it. So, and you redose it at 28 days. So those are the real differences. From a clinical standpoint, the side effects are the same for both vaccines. The main thing is, when do you get the other one? Now, you mentioned Johnson & Johnson, which is coming out. That one, the one difference is it's going to be just one vaccine. And we don't know if you ever are going to need to get a second vaccine, just like we don't know with the current vaccines if we're going to need a third booster at some point in time, because we just haven't elapsed enough time to see how long these antibodies are going to remain in your system.
Right. I think you've answered this question already, a portion of it, but I just want to ask it a different way from a different person. If you have pulmonary fibrosis, osteoporosis, and COPD, should you still get the shot?
Absolutely. I mean, you are like on top of my list, just like the person with the kidney failure. Absolutely. Pulmonary fibrosis, if you get COVID, bye-bye, hasta la vista, baby, because you will die. I mean, it's that bad. Osteoporosis is not a big deal, and COPD, as we said, puts you up on the list. But pulmonary fibrosis, one of the problems that you have with patients that get COVID is that they get even more fibrosis. So if your lungs were already messed up with your baseline pulmonary fibrosis, I mean, this is just going to come and kill you. I mean, it's that bad. So I wouldn't think about it twice. I would go ahead and get vaccinated.
Dr. Varon, does double masking really add extra protection from contracting the COVID virus?
Depends on who you talk to, and depends on what week you talk to. I mean, if you talk to Dr. Fauci, one week he says yes, the next week he says no. And the fact is that, the most important things, again, my recommendations for everybody, and this is fairly straightforward. If you can, get the vaccine. Continue to have your social distancing. You wear a minimum of one mask and avoid going to crowded places. Remember that 48% of people that you don't know that they are, because they are asymptomatic. Having a second mask, I am not sure it makes a difference. At the beginning of the pandemic, I took all my medical students and we went to a lab and we used every possible mask that you can imagine. And we went ahead and we insufflated a kind of like a fake COVID. And every single mask showed that you had some entrance of COVID through the mask. When you are using a mask, the reason why we are wearing a mask is to protect the other person, not to protect yourself. Right. And that's what most of us don't understand. Let's call it is a sign of being educated. When you are using your mask, I do that as a courtesy to you. Mm-hmm. We know that the best instances where you don't get COVID is when both people wear masks. So in that regards, yes, two masks are better than one, but two masks when you have two individuals that have the mask. I think that the jury is out as far as whether or not double masking everybody is going to make a difference.
What effect would a vaccine have on a person who is awaiting a heart transplant?
Well, that's even more important. You see, the vaccine is, again, if you are awaiting a heart transplant, go ahead and get the vaccine. Because one of the things that they do when they give you a new heart is they give you medications that decrease your immune system. Well, the last thing that you want is to get COVID with a weak immune system. So might as well have some antibodies in your system ready to fight the COVID if you are to get the COVID.
At what age should children receive the vaccine?
Well, that's another excellent question. And, I really like these questions. They were all very well thought of. In the US, we are not giving the vaccine yet to people under the age of 18. That's in the US. However, when you look at countries like Israel started vaccinating, initially they're 16 to 18 years old, and now they're going to the 12 to 18, and they are having no problems with kids. The way I look at COVID vaccination, I think it's going to become part of the, all the vaccines that kids get when they are growing up. I truly believe that that's what's going to happen. I'm not sure whether we as adults are going to have to get more vaccines as these new strains of COVID are out there. But it is likely that, this will be like the flu, that every year you're changing, they're changing things, and we'll see which one is the worst. And then that's the kind of vaccine you will get.
We have a question from a participant in our chat. She took the first vaccine on January the 27th, and the second vaccine is due February the 27th, according to the card she received from them. Is this too long to receive the second dose?
Well, it really depends on the kind of vaccine. I mean, whether it's, if it's Pfizer, yes, it is. If it's Moderna, it's not. Indeed, we say 28 days, but you can go 3, 4, 5 more days without any major problem. So that if for whatever reason you don't get your vaccine, the second vaccine on time, you don't need to panic. The only reason why they chose those dates is because those dates were the ones that they used on the studies that are allowed the government to approve this vaccine.
Dr. Varon, some people have concerns because a lot of the drugs that are on the market take years to come on the market, but this drug was pushed in 9 months. So can you explain the rationale why this vaccine is okay to take and the amount of time that it took for the vaccines to come on the market?
Yes, well, that's another excellent question. The fact is that no, you are all wrong. This vaccine didn't get developed in 9 or 10 months like people think. This vaccine was developed over decades of scientific research and vaccine development. What we did was to utilize the technology that had developed over decades, and then the Trump administration, out of everything, actually, the one good thing they did was they infused a lot of cash into the pharmaceutical industry and allow them to do studies really fast. But this is nothing. I mean, the vaccine didn't get developed overnight. The vaccine didn't get developed in 9 months. The vaccine got developed through decades of scientific research. And if your concern is that this was a vaccine that was, quote, too fastly developed, then you are wrong, because it didn't get developed overnight. It got developed over a long period of time.
Another question in our chat. Are schools really safe right now? And piggyback off that, should teachers take the vaccine before they arrive back in the classroom?
Ooh, you got into one that I'm very passionate about. Actually, yesterday morning at 4 o'clock in the morning, I was watching the news and suddenly I hear that the head of the CDC, this lady, she was saying that, teachers didn't need to get the vaccine. I think that we need a new head of the CDC. And I will say that loud because to me, I believe that teachers, teacher aides, people that work in schools, to me, they are frontliners. They are people that are exposed to all of these kids, and many of kids will be completely asymptomatic. You have no idea how many teachers aides I've had in my unit with one foot on the grave. I mean, that bad it is. So yes, teachers need to be vaccinated. And whoever says that do not need to be vaccinated need to come and spend some time with me in my COVID unit to see what the reality is. Now, are schools really safe? Well, it depends on the school. It depends on what kind of protocols they have as far as distancing of the kids, which, to be honest with you, I mean, try to socially distance a kid is basically impossible. I mean, there are a lot of things that if you look at how they do things in China, kids get their PCR test on their nose 2 times a week. I mean, it's pretty impressive how they're doing these things. Here, of course, we're not doing such thing, but it depends pretty much on the school. Depends on, is there any social distancing? I mean, are the kids separated with any kind of a plastic protector? And then what do you do for the kids when it's time to go out for a break? I mean, those are the things that we don't know. So I will tell you, it really depends on the school system and how well enforced are the rules. Because I don't know if you've seen kids trying to wear a mask. They wear the mask like down here, or they wear it down here, and they wear it everywhere but the place where they have to wear it.
This is a piggyback off an earlier question about children receiving a vaccine. One question is, would you recommend for the children to take the vaccine? And B, what age should they take the vaccine?
The answer is yes, I would recommend it. I would recommend that they get the vaccine. As of now, I cannot recommend it to anybody under the age of 12 right now, because I don't know any data for kids under the age of 12, but my goal is to recommend it for babies as I'm going to say as early as newborns. Now, one interesting thing is that the first 2 years of life are extremely rare to see kids that develop COVID. It happens, but it's rare. Why? If you remember, the COVID has these little spikes. The spikes, in order to get into your body, they need to kind of anchor themselves to the cells. To anchor themselves to the cells, they need to use a little thing that is called a receptor. Well, for whatever reason, in kids from 0 to 2 years of age, those receptors are not fully developed. That means that you may have the virus, in your nose and stuff like that, but it doesn't gets stuck to you. That's why kids don't get as sick when they are babies. Yes, they have been cases, but not too many of them. So I would envision that if there are guidelines that the pediatricians will be putting in the next few years over COVID, they're probably going to say, kids older than 2 years of age should get vaccinated every so often. But for now, as far as I know, at least worldwide, kids are not being vaccinated under the age of 12.
This is a two-part question. 70% of the American population is needed to take the vaccine in order to have quote unquote herd immunity. If African Americans, Hispanics, Native Americans refuse to take the vaccine in large numbers, how would that affect our society in getting back to a sense of normalcy? And B, when can we stop wearing masks and social distancing?
That's a huge question. And I'm going to tell you, number one, the question is wrong. Because you mentioned that for us to either go back to normal or stuff like that, you need to vaccinate 70% of the American population. That's wrong. In order to go back to normal, we need to vaccinate more than 70% of the global population, okay? Mm-hmm. Not just the United States. We live in a society that travels.
Right.
Have a lot of people going back and forth, countries, stuff like that. Now, that means that we have to vaccinate 5 billion people. That sounds like a big task because you have to have 5 billion vaccines produced. Then you have to have a system that allows you to distribute 5 billion vaccines in a fair manner, not just to the rich. I mean,
right.
And that's, that may be easier to say in the US, but what about Latin America? What about Africa? You know that only the wealthy people are going to get vaccines over there. You all know it. You know it's going to happen. So, and then the last and most important part is how in the world do I convince people to get vaccinated? That's why when people tell me, well, there are people from other places coming in to get vaccinated, I said, look, just vaccinate away, vaccinate every single person that wants to be vaccinated. And then if I was in charge of being part of the Biden administration task force on COVID, I would say what we need to do is we need to have a huge educational campaign. Just like all those annoying ads that you guys get before elections, I would just start blasting ads, vaccinate yourself, why, talk a little bit about the history of the vaccine, talk a little bit about the safety of the vaccine. Those are the things that need to be done. And as you can see, I'm very, very passionate about this because, I have kids. My kids are adults, but eventually I want to have grandkids. And if we don't take care of business, I'm not going to get to see grandkids. It's looking that bad from my standpoint because a lot of people don't want to get vaccinated.
If there's another question that came to chat, if there's a gathering where we all have been vaccinated, will masks still be required to wear?
Yes, I would say the answer is yes. So let me backtrack just a bit because you asked me, when do I think we're going to have a sense of normalcy or,
right.
When are things are going to be better? And then at the same time, we can talk about masks. So if everybody listens to Dr. Varon today, and let's assume in this ideal magical world where people actually listen to what I have to say, which that doesn't happen too often, if everybody was to listen to me today, I would tell you that towards the end of this year, we probably could control the pandemic in the United States. Towards mid next year, we could control the pandemic in Mexico. Towards the end of 2023, we could control the pandemic in Africa and Asia. So we're talking about several years of dealing with this. And as I said, because we're a very mobile society, the fact that you control the pandemic in the US doesn't mean you are controlling it in other places. And you can still have people traveling back and forth, and you can start reinfecting the population. And we don't know how long this vaccine effect is good for. So that's why, in response to your question about the masks, I would say the masks are going to be with us a minimum of 18 to 24 months. And if you go back in history, if you go back to the 1918 Spanish flu, it took almost 3 years for people to start dropping their masks.
Wow. Are there any side effects persons are currently, are there any side effects of persons who currently receive chemotherapy should be aware of?
Not really. I mean, again, the side effects are the same ones that we discussed, and trust me, they're going to be much more milder than the ones that they get from their other medications.
All right. I'm going to open the floor now for persons who would like to ask Dr. Varon questions directly. I don't have any pre-submitted questions, so if you have any questions to ask the doctor verbally, you can definitely have that opportunity to do so at this time.
Don't be shy. I don't charge any money for questions. On the contrary, they are all free.
I believe.
Dr. Varon,
Go ahead. Go ahead.
can you hear me, Dr. Varon?
Yes, I can hear you perfectly.
Hey, this is Eric. How's it going? Quick question. Dr. Fauci, of course, we know he is the one that is addressing the nation. What is the difference in what you're basically saying versus what Dr. Fauci said? What is the difference with you guys?
Well, I mean, let me tell you, Dr. Fauci clearly has done a good job trying to put together a lot of data and try to make it kind of something that people can understand. But having said that, I am not aware that Dr. Fauci has taken care of patients with COVID on the front lines like we've had. You know, when you see hundreds of patients with COVID, when you know what they die of, when you know what their concerns are, what the concerns of the families are, you have a completely two different points of view. I also understand that Dr. Fauci was under a lot of political pressure for a period of time. And I also, probably that explains why he kept on changing his tone and his message. The one thing that this country has had that has had a lot of issues has been that we have not had a unified message. I mean, you have Dr. Joseph Varon telling you something. You have the president saying something. Then you have Fauci saying something. Then the CDC is saying something, whereas the World Health Organization is something completely opposite than what the CDC says. Fauci would say one week, no masks are required. The next week, yes, masks are required. And in all fairness to Dr. Fauci, we have learned a lot about COVID as the time has progressed. But we need to have a unified thought process, a unified way of doing things that we have not achieved. We need to stop all this political nonsense and stop politicizing this illness if we really want to control it. And, you know, I respect Dr. Fauci. I believe that he's a very bright gentleman, but I cannot see him taking care of any of the patients that I see at the bedside and realizing what the real problems are. I mean, you know, I respect him. Again, I've read some of his books. I'm sure he has not read any of my books, but that's okay. I mean, I am at the bedside of the patients with COVID. He is looking at the big numbers, the epidemiological trends and stuff like that. And of course, you know, he has, I'm sure that he has politicians getting on his back every 2 seconds.
Hi, Doctor. My name is David Harris, and let me commend you for the amount of days that you've worked consecutively. And we pray for you and your family as you continue to be on the front lines. Obviously, you're here today to answer questions in regards to the test and taking the vaccine. My question leans more to, are you also involved with trying to work to make sure that this vaccine is available in those communities that you spoke about, which is the underserved community? So are you actively involved, not only just working, I don't want to use the word just, not only working at the hospital bedside, but are you talking to folks to help them understand that those underserved communities need this vaccine as well?
Oh, yes, I am. And I'm a pain in the neck because I don't know if you guys heard, but, you know, when the vaccines first rolled out on the first time around, UMMC in 7 acres didn't get a single vaccine. So I went on every TV station, on every news, every whatever, because we needed to get vaccines for us who care for people who are, you know, poor, for those people that are indigent. I would tell you 70 to 80% of the patients that I have in my hospital do not have money. They don't have any money for the medications that we have to give them when they leave the hospital. I mean, that bad. So yes, I've been fighting to try to help in that sense, but the whole problem is that the whole vaccine allocation, it's a royal mess. I mean, I've talked to the mayor, I've talked to Sheila, I've talked to several representatives trying to find a way by which we can all get vaccines. But I mean, you saw it. MD Anderson Cancer Center initially got a gigantic batch of vaccines, whereas we, UMNC, who has been on the forefront of COVID, we have become a center of excellence of COVID, we got none. I just couldn't believe it. So I've been trying. It is a very difficult situation. And to be honest with you, David, I think that the only way to do this is to have something at the federal level, some kind of organizational way to do it, in which the next part of the population that would be vaccinated would be those people who are difficult to get to. Those communities that are not going to come to the hospital to get vaccinated or go to a center because they don't have a computer to be able to enter their data into this database. I mean, anybody that thinks that everybody has a computer and everybody's literate to do it, I mean, they don't know what they're talking about.
Well, the follow-up to that, you're absolutely right. There are so much deserts when it comes to drugstores in our communities. And I know that's part of the overall plan. And so when you do get a chance to speak to those leaders, just there at Cashmere Garden, I'm thinking out loud now, I believe there's a drugstore off Lyons, which is 4 or 5 miles away and so forth. So there are very few drugstores. When they start talking about sending it out to those communities through drugstores where people can get vaccinations, I'm concerned about that as well. So my final comment is, as you continue to be on the front lines and communicating with those leaders, consider speaking to the fact that there needs to be some concentrated effort to get the vaccines to those communities, and possibly talking to church organizations like what you're doing tonight to assist in that process.
And I think that that's a very good idea, because if you look at it right now, I live in the Meyerland area, and actually, I look at the map of who has been vaccinated, and yes, a lot of people in the Meyerland area are vaccinated. But if you go a little further back to like the Fondren area, nobody has been vaccinated, and that's like 3 blocks away from here. It's not that difficult. And what's the difference? Well, the difference is income. That's the truth. Why? Because probably the people that are here have computer systems and I can enter data, or they all have primary care doctors that, send them a nice little text message and says, hey, we have vaccine available. Because some of the hospital systems, as you know, they were sending massive text messages with that. No, I mean, I do believe, David, that you are correct. I mean, when we come up with there needs to be a better distribution plan. But just as I said earlier, it is not just those communities. Every community needs to be vaccinated. We need to go door by door throughout the world, for that matter.
So, Dr. Varon, I have a question I had earlier last year, and I'm concerned about the antibodies in your system that you already have built up, and then you take the vaccine. What does that do to the antibodies? And if it's necessary, if you've had, how do you gauge that?
That's a great question. And for those of you who did not hear it, the basic question is, if somebody has COVID, should you vaccinate them again? And what's going to happen to your antibodies? Well, let me tell you what I'm doing right now. We know from studies in South Korea that the antibodies that you get in response to the infection, to the active COVID, last in your system for about 3 months. So the fact that they last for 3 months would indicate that, you're not going to have them forever. So I am not vaccinating anyone that has had COVID in the last 3 months.
Right.
Having said that, after 3 months, I am giving them the vaccine. And depending on how they behave, I decide if I give them a second vaccine. So, for example, one of my nurses had COVID in late July. And we gave her the vaccine at the end of December, and she got actually pretty sick. So I said, this doesn't make any sense. So what I did is I went ahead and I checked her blood levels of antibodies, and her antibodies were very high. And I made the executive decision that she's not going to get a second vaccine, at least not for the foreseeable future.
That was my question, because they're telling me when I get the second one, it's possibly going to make me feel even worse, because the first one made me feel worse than I did with COVID. I was really almost deathly sick. I was really sick. So I'm afraid to take the second one because I don't know if it's going to do me worse. Need it.
So what I would suggest in your case is that, you go to your healthcare provider and tell them, look, I felt really sick with the first vaccine. Could you please check my antibodies, see where they are, and see if I really need a second vaccine? There is nothing wrong with that. I think that, you bringing that point to your healthcare provider will be okay. The test is relatively inexpensive. It's very easy to do, and literally takes less than 24 hours to get results.
Good evening, Dr. Varon. First of all, I want to express my sincere appreciation for you taking the time out of your extraordinarily busy schedule to be a part of this audience of persons that are so interested in our entire COVID system. My name is Brenda Carr, and I'm a member of Cashmere Gardens Church of Christ. And my second hat is my professional engagement. I work for a very large senior community, Brookdale Senior Living, and I've been firsthand as the essential caregiver to those residents that have, some have had COVID. And we are testing daily. So I just had a COVID test this evening. And I want to say to all that are listening now, I have had both doses of the Pfizer vaccine. And quite honestly, I'm feeling okay. I just had a little soreness to the injection site. And with both of the vaccines, there really were not any residual issues there for me at all. But primarily, I just encourage everyone, as you are, I'm echoing the same thing. We need to really get the vaccine. We were a part of having a COVID unit on our campus. And of course, some did pass away, and then others were able to do pretty well and go back to their environments. They were all within the system of our healthcare delivery. But I just wanted to say to each of us, we really need to get the vaccine. The benefits certainly outweigh the negativity of a few uncomfortable side effects. So I know everyone's different, but I am encouraging everyone to get the vaccine.
And and one more thing that I want to tell people is that please, 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 every time you see something on Facebook, Instagram, Twitter, close your eyes. Close your eyes. Because, the only things that I see there are negativity. People are not helping each other, and there is so much misinformation in there. I mean, the fact that it was the previous president, the one that kind of threw in the cash for these things with the help of senators, stuff like that, should have no bearing on your decision to get the vaccine. You need to get the vaccine based on the fact that if you don't do that, you may not have another opportunity. This is your golden opportunity, because between now and the time that you change your mind, you get COVID, we will not be having this conversation again. And trust me, there is nothing worse than seeing a patient that dies from COVID, a patient that suffocates to death alone, no family members at the bedside, no prayers at the bedside, nothing inside. Everything is done outside. That is really bad. As a doctor, I don't like it. You all have seen my picture with the elderly gentleman that I held on Thanksgiving Day, who was crying because he wanted to be with his wife and he couldn't be with his wife. I mean, those are the things that people need to understand. Let's stop being so polarized, pro, against. Just let's be one. Let's have one unified thought process, one unified front. Let's all get vaccinated. I got the vaccine, as I said. I haven't grown a third eye. I haven't grown a tail. I'm a little crazier, but that's probably because I've been working for 323 days. But it is important that we all work on this together. People, I need a break. The only way I'm going to get a break is when we control this nasty illness. And we can start controlling it by following our basic concepts of social distancing, wearing your mask, and not going to large crowded places like, those clubs that pop over the weekends out of nowhere. And then, hundreds of people are there. And obviously to get your vaccines. I am more than happy to put my license on the line to let you know that you will not have any major side effects that will, any life-threatening side effects.
Dr. Varon, go ahead.
Okay, Dr. Varon, this is Carol White, and I thank you too for empowering us for this with this information to keep us alive. My question is, I had seen on the news where the Johnson & Johnson has a vaccine that's coming out probably in March that only has 66% efficacy. Is this enough to prevent or curtail the virus so that it won't be so deadly?
I don't think so. I think that you need to have vaccines that have more than 90% efficacy. And again, watch out with what you hear of the J&J, because, one paper comes out saying that they have more than 90% efficacy. Another one says 60%. The one that I will tell you that do not get is the Chinese vaccine, because the Chinese vaccine has only 50% efficacy, and that is for real. The Sputnik vaccine, which is a Russian vaccine, actually is quite interesting. There is a paper that just came out yesterday on one of the British journals that show that it has good efficacy. So that you guys know, there are 200 vaccines that are being done. So I truly believe that by the end of the year, we're going to have vaccines up to the wazoo. One of them is an interesting vaccine that is being developed by one of our own here in Houston, Dr. Peter Hotez, who is at Baylor College of Medicine. That's the other gentleman that is always on TV with a little bow tie. Mm-hmm. He has developed a vaccine that is being produced in India, and it's being used in India, and it's very good. It has a fantastic safety profile. Eventually, studies need to be done in the States so that the FDA can approve it. But as far as vaccines go, I think we're going to have a lot of vaccines. My message to the community is, get whatever you can get, except for the Chinese. Get whatever you can get. And right now, you have either Pfizer or Moderna. We can revisit this subject later on when they have other vaccines to make a decision if any of the other ones have any issues that I am concerned about from a clinical standpoint.
Thank you.
Doctor, I have a question. You hear about the different strands of the coronavirus that have developed in Great Britain as well as South Africa. And are those concerning to the US, if those strands, and how would the vaccines be able to react to the different strands of the coronavirus?
That's a great question. Actually, I got the news people asked me the same question today. And I will tell you, the first thing that you should know is that we've known about these strains from day one. Actually, last year, exactly at this time, I knew about 9 different strains. So the strains have been around, and what happens is that the virus tends to mutates, change its genetic code. That will continue to happen. And, we had it when it was called SARS in 2003 in Singapore, and then you have the MERS in the Middle East, and now we have COVID. Now we know that COVID strain, the one that we currently have, we know what it does and stuff like that. In the United Kingdom, the British strand, we know that it's more contagious, same as the South African strain, same as the Brazilian strain. Now, from a clinical standpoint, to me, it makes absolutely no difference what type you have, because I treat you the exact same way. It doesn't change. People with COVID die from excessive inflammation of the lungs and excessive coagulation or clotting of the blood vessels. Simple as that. So my goal as a doctor is to decrease inflammation, decrease the clotting. End of story. Now, the Prime Minister of the United Kingdom just a few days ago said that he thinks, and again, this is his thought, that the new strain is a little worse and that people are dying more. I am not sure that that's the case. I am seeing more people dying, but I'm seeing more people dying because people are coming to the hospital late. They are not coming in early. The average patient that comes to my unit does that after 2 to 3 weeks of having symptoms. So who in the right mind goes to the doctor 3 weeks after they start having symptoms in the middle of COVID?
Are there any more questions for Dr. Varon at this time? We're going to start wrapping everything up. We don't want to take too much of his time and more of his time. So do we have any other questions that need to be asked of the doctor?
Let me before you ask the question, let me just finish. Your question was whether or not the vaccine covers these other strains. The answer is at the present time, yes. But if we don't control the virus as it is right now, eventually that virus will mutate and the vaccines will not control it, and we'll have to get new vaccines. And that's what we said at the beginning. Maybe 2-3 years from now, we'll have to get yearly shots that have been allocated to a particular strain of the virus. Okay, now go ahead with the question.
Yes. Good evening, Dr. Varon. My name is Gwen Carr, and I too thank you for taking time out of your busy schedule to address our questions. One of the concerns in our community that I've heard voiced is that in the ingredients found in the COVID-19 vaccines is the live virus in it. Does the COVID-19 vaccines contain the live virus? That is one of the things that too has caused a fear in our community.
Well, first of all, have no fear. Okay, that's the first thing that I should tell people. And I mean, more importantly, if you guys have any fears, any concerns, don't look up on Google or on Facebook for an answer. Call your healthcare provider. I mean, when I really understand the concerns, but I mean, we can talk for hours of the different concerns, and at the end of the day, the basic facts is the vaccine is safe, the illness is really bad, and if you can get it, make it happen.
Yes, and I too agree with that. The benefits far outweigh the risk, but that is a concern that is being voiced in the community about is the virus part of the live virus part of the cure.
I mean, I wish we all had an answer for all of those things, but what the community needs to know is that the virus kills, and the virus, for whatever reason, likes to kill minorities, loves to kill minorities. So why don't we just fight the virus with the smartest possible way that we currently have, and that is the application of the vaccine plus the other measures that we talked about.
Thank you.
Any other questions? Don't be shy. They are free.
This is Slayola, Sherry, and I want to thank you so much for demonstrating your love for the people and giving us some factual information so we don't get all this misleading information. Of course, I know you're dealing with so many other aspects of this type of disaster. As a senior citizen, it's very difficult to get into some of these places. And I suspect because of the volume of people going in. But I just want to thank you for encouraging me to go ahead and be consistent and trying to get in because it has been a challenge. But I do want to thank you for demonstrating the love for the people, because it helps the morale of the people also, knowing that we're involved in something blind, and we have to trust professional and people like yourself that's constantly giving up their time and resources and all that goes with it to help the nation become a stronger people. So I do want to thank you personally, and I know the community is great to have you on, and we hope to have you back.
Hello. Yes, I have a question. My name is Kim Young, and I want to know the vaccine. When you take the vaccine, both first and second time, will you die from it? Is it a possibility that you can die from the vaccine?
Well, there are lots of, I mean, I guess everything is possible in this life, I mean, let's say that you are one of those people that are scared of needles and they put a needle next to you and then you faint and then you and then you hit your head and you bleed into your head. I guess, yes, the answer is yes, it's possible. Now, as far as I know, there is only one case of a person that died in Brazil out of a vaccine, and that is and it's under what I call very suspicious circumstances. But think about it. In the United States, more than 30 million doses of the vaccine have been given. If somebody dies as a result of the vaccine, well, that person probably should go and start buying lottery tickets because, man, that's a very unusual luck.
Right.
We want to thank Dr. Varon for spending this afternoon, this evening with us today and answering our questions. And we trust that hopefully in a couple of months, we will love to have him back on again to speak with us and get an update on where we're at today and preferably and hopefully we'll be further along in the process. Thank you very much, Dr. Varon, on behalf of the congregation and the community here in the Cashmere Gardens area and in the greater Houston area and throughout the country. We thank you for your time you spent with us today. For those, thank you very much for that. To close out, we would like to, if everyone doesn't mind, we would like to have a prayer said for those persons like Dr. Varon, who's on the front lines, persons like Sister Brenda Carr, who's on the front line, and others who are on the front line. We also want to pray for those persons who are dealing with this virus, either as a family member or individually who has contracted the virus, and for those families who are grieving the loss of family members who were lost due to the virus. If Brother Reed Johnson is online, can you please lead us in prayer for those persons at this time? And following the prayer, we'll be dismissed. And we thank you, Dr. Varon, again for spending time with us. And we thank all of you for being our informed persons as well, and to learn more about the virus and the vaccine. Brother Reed.
Okay, let us bow. Dear Father, we come to you. We come to you just asking you to continue to bless us, continue to watch over us. We want to thank everybody that's on tonight to learn more about the vaccine and what it does to the community. We just want to continue to pray for men like Dr. Varon and just other men that are in the profession. We want to, even though he's hadn't had off day, we want to just pray for him that he keep on with the fight because he's doing a lot for the community, doing a lot for the nation. We want to pray to you that all the people that has contracted the virus, pray for them. We want to pray for them, pray for their families, pray for their loved ones. We know in this time it's hard for the loved ones to even come to the hospital and see their relatives, but just pray for the whole family as they try to recover from the virus. Pray for the ones that lost loved ones. We know that anytime you lose a loved one, it's an experience to the family, but we just want to pray for those families to be strong. Even though you may have lost one, but just continue to be safe. Continue to do the things the doctor tell you to do, that you will stay healthy and may help somebody else to stay healthy. We just want to continue to ask prayers for the Cashmere Gardens community as this continues to struggle with the virus. But we want them to always know that you still have prayers and prayers still go up. We know the doctor's on God's, but sometimes God gives men the ability to do things and the ability to have the knowledge, the studies to pass on and stand in for him sometime, not to heal, but to have medicines that will help mankind all the way. So we want to just continue to pray for our doctors that are all in the medical fields trying to heal up people and all doctors out there that's everyday doctors that be seeing patients. We want to continue to bless them. We continue to bless everybody that's on tonight. Continue to bless their families that they all will be safe. And these blessings we ask in our son's name and thank everybody for being on. Amen.